Hi there from Help Campus. We're here to give you another tip for your PANCE or your PANRE. Doesn't make a difference which test you're taking. When you sit down at that test, you're going to have a whiteboard, which is a dry erase board, about the size of a piece of paper that you can just dump out whatever information you might need. It has to be in your mind at the time, but that means you better prepare before your test and know what your personal whiteboard moments are. Now, what are whiteboard moments? They're the things that you just can't remember. You need some quick, easy ways to get them down. Now, there's lots of whiteboard things in our review, but we're going to go through just a few of them today just to give you some examples. Mr. Taps, unstable equals electrical, and all convicts make a mess of their cell. We're going to explain this in a minute. Let's say you're having a hard time with the adult systolic heart murmurs. Well, you can use Mr. Taps. It's quick to write out, and we understand that the adult systolic heart murmurs are made up of MR, TR, AS, and PS. So mitral regurg, tricuspid regurg, aortic stenosis, and pulmonic stenosis. Now the opposite is true for the four main diastolic murmurs. So then it must be mitral stenosis, tricuspid stenosis, aortic regurg, and pulmonic regurg. How about dealing with an arrhythmia question? The truth is it all hinges about the stability of the patient. If your patient is unstable, it's always electrical treatment first. And this is even easier, for example, with bradycardia. It doesn't make a difference if the bradycardia is sinus bradycardia, if it's third degree heart block, if it's second degree type 1 or 2. It doesn't make a difference why. If you have an unstable patient who has a bradycardia, then you're going to be using external pacing, then moving to transvenous pacing, and possibly permanent pacemaker. But it's all about pacing. If you have an unstable patient in the question who's tachycardic, let's say a rate of 220, it doesn't make a difference if it's AFib or a flutter or sinus in origin. You're still going to use synchronized cardioversion. If you have a patient in the question who's in cardiac arrest and is in VFib or VTAC in cardiac arrest, you're going to start with unsynchronized cardioversion. If the patient's stable, that's when you can start with a medical treatment. How about hematological malignancies? This is something that's very difficult for many people. How do you deal with ALL, CLL, etc.? Well, the question likely is going to ask you one of two things, if not both. The age distribution of your patient and whether or not the cell line you're dealing with is a blast line or one of the derivative lines. So, let's look at this. First thing we can write on our whiteboard is all convicts make a mess of their cell, meaning all ALL, almost always children. Convicts make CML, young to middle-aged adults. A mess, AML, almost always middle to older age adults. In their cell, CLL, almost always older adults. Now remember also acute is a blast, because if in acute leukemia, whether it's AML or ALL, you're going to have either myeloblasts in AML or lymphoblasts in ALL. And of course if it's CML, then you're going to have either leukocytes such as neutrophils, etc., or you're going to have lymphocytes themselves. I hope this helps you and gives you a good tip on what you should do to prepare for your exam. Best of luck in all of your studies, and have a great day.